All right, do you have the turkey neck? Is that what we call it now?
Yeah.
Just that loose skin right here. If you're looking for maybe a non-surgical solution to that sagging skin, maybe Venus freeze is for you. There's also a more invasive way, of course, and Dr. Jennifer Walden is here to tell us more about these procedures. So there's something for everyone, you know, depending on your budget, I would imagine, and also how invasive you want to go. So is this something that we all kind of worry about right here?
Yeah, I mean, the waddle or your turkey neck has to do with genetics, how fast is the fat deposit and your skin sag over time. And we have several options for that. The Venus freeze is radio frequency thermal energy. That's a non-invasive wand that you can get 6 treatments once a week, and it will actually melt the fat and it'll tighten the skin there. So I've gotten it. It's great for people that are on the go and just want to go to the doctor's office for 20 minutes and relax. It's painless.
Yeah.
So it's a good treatment.
So even you've received it?
Yeah.
Okay, so this is something that is just kind of common, more affordable, I would imagine, than a surgical procedure.
Right. So Venus freeze or a non-invasive procedure like that generally is going to run about $1,500 to $3,000 for 6 to 8 treatments, depending on the area of the body. A surgical face and neck lift could be around $10,000 to $15,000. So significantly more, but with a surgical neck lift, you're actually going to get a very definitive, dramatic, long-lasting result in a matter of hours.
Sure, and some downtime when you heal as well.
Right.
We have some photos here. Oh, okay, this is what the Venus freeze machine looks like here. And is that right?
That's the Venus freeze machine, and basically you dial in the amount of time and the amount of energy. We can treat the neck, we can treat the abdomen, the flanks, the arms, and tighten those areas, and also melt the fat by the radio frequency energy.
So it's not just for the turkey neck.
Exactly, not just for the turkey neck. It can be used all over the areas of the body. That's actually a surgical neck lift.
Okay.
And so you can see she's had liposuction. The muscles of the neck have been put together in a chin implant. So that's actually surgery that can produce those results. That's a surgical neck lift as well. So I've done a face and a neck lift on her and put the muscle bands together in the neck. You can see a dramatic result as the waddle is now gone.
Absolutely. Okay, and then do we have any of the Venus freeze? Oh, we don't. Well, you know what? We'll get those photos for you. We'll stick them on the website for us later on this morning. But this is very interesting, too. Is it preventive as well, or is it really treating?
It's really treating those areas. So
do we need to be using creams and stuff now in our 20s and 30s to prevent this?
Creams and topical agents really can't tighten the skin like these new non-invasive devices, and certainly surgery can. So those can only really penetrate the superficial layer, like a Retin-A, can remove fine wrinkles and tighten the collagen a little bit, but really all those over-the-counter products don't help with this type of thing.
Well, talk about, too, can you find, I don't know, I've seen those infomercials or even on the Home Shopping Network, all those radio frequency things as do-it-yourself at home items. Obviously, this is something you wanted to have done in a doctor's office for the real results. Right.
There's stronger energy levels. They need to be done in a doctor's office. You know, usually going to a board-certified plastic surgeon or a dermatologist for these non-invasive treatments, really, because they can administer higher energy levels and get better results than any do-it-yourself thing over the counter. The FDA has approved the Venus freeze for this indication using radio frequency and pulsed magnetic fields to help tighten the skin and melt the fat.
Well, and you know, when you look at the price tag and you may think, well, it's a lot of money, but at least you're getting some bang for your buck than, you know, going through these infomercials.
Right.
Yeah. All right, Dr. Jennifer Walden, thank you. Very interesting. Okay. Don't go